Welcome, everyone. Thank you so much for joining us today. My name is Youngmi An, and I am the manager of the Resource Library and Educational Programming here at Ridley-Tree Cancer Center. Thank you so much for joining us for this live community lecture webinar presented by the Ridley-Tree Cancer Center and Cancer Foundation of Santa Barbara. So I am honored to introduce today's speaker, Dr. Scott McCann. Dr. Scott McCann facilitates the Ridley-Tree Cancer Center's prostate cancer discussion group. Previously, he taught human sexuality at Antioch University and Santa Barbara City College for 20 years. He's a former education director for Planned Parenthood and Santa Barbara County Public Health Department. Please welcome Dr. Scott McCann.
Hello. Thank you, Youngmi, for the nice introduction. So I am technically a doctor, PhD, but you can ask medical questions, but I'll probably refer you back to your care providers. I certainly know some of the physical questions, can answer those, but my specialty really is in healthy sexuality and intimate relationships. But I've learned a lot from the prostate group members at the Ridley-Tree Cancer Center. I encourage you to join a support group if you're not currently a member, because it's incredibly valuable for the people who it fits for. So today we'll look at defining sex, sexuality, and intimacy. Briefly look at some of the impacts of your own sexual learning history that might affect your current feelings and behavior. What are some of the common challenges for older adults that are sexuality related? Because a lot of them are the same, just amplified with going through cancer and cancer treatment is what I've seen and learned. But then specifically treatment effects and cancer effects on both sexual feelings and functioning, as well as intimacy. And then lastly, what can you do to help maintain and build intimacy and maximize sexual involvement to the degree that you want? So just so you know, I've been doing this really for about 30 years, sex education. So I'm real comfortable talking about sex. So I use specific terms, and I think one of the problems is our culture is not generally real comfortable talking about sex in a normal way. So I hope you feel free to share with whatever language you feel comfortable asking questions and sharing stories. There are a couple of images that vibrators and stuff that are here that are a little bit specific, but nothing too wild here. I want to get into just the ballpark that we're going to be dealing with, and that is this concept of holistic sexuality. I put it's an umbrella term because it includes all the things in these circles you can see on the screen. You've got sensuality, all the body stuff, skin hunger, just simply the desire to be touched, which is pretty much an innate thing for most people. All the way down to body image, a huge factor for people dealing with breast cancer in particular, but to some degree with prostate and other cancers. Intimacy is the other big category I think we're going to be focusing on. Loving relationships, vulnerability, trust, communication, all the things that go into that. Not really much on sexual identity, gender identities, and sexual orientation. That's kind of another discussion. Some of it overlaps with the sexual health and reproduction, the bottom left circle there, in terms of sexual dysfunctions or problems. And then sexualization, not so much. That's really about applying sex where it doesn't belong. Flirting, I guess you're trying to find out if someone's interested in you, but the rest is really, to me, abuse of sex in advertising and, of course, sexual abuse and so on. So really the upper two circles, the middle, and the right and the top. Sex to me is any kind of sexual behavior. Typically it's involves genital contact, but not even necessarily, and I'll give some examples of that. Much broader than the usual definition. And then intimacy really can boil down to feelings of closeness and integration with another person. I like just the 3 Ps of sex that capture most of what people deal with at some point in their lives: the pleasure, the procreation or reproduction, if you choose to go that route, and then partnerships that we'll be talking about today. Let's see, sexual learning history is really important. I encourage everybody to look at their own learning experience, life experiences related to sex and sexuality. We all have these three things of the sources of influence. What messages or specific experiences did you have that influenced your thoughts and feelings and actions? And then ultimately, what are the effects? How does it affect your behavior and other things, both in the immediate sense after you've experienced something and in the long term? So we could all go through this. This could take, you could write a book on this, I think, most of us. But from beginning with your parents, probably the most primary influence for most people or whoever raised you. What did they talk about? Did they talk about sex at all? Was it positive? Was it negative? Most people, again, in our culture are not comfortable and open talking about sex, particularly with children. They think they shouldn't learn about it. As a sex educator, I absolutely believe it should start young and build on it throughout our lives, the information we get about sexuality. And you can see an example I gave was if your parents don't talk about sex, then you're not going to be comfortable or even know how to talk about sex comfortably. So things like that, other family, siblings, other relatives, you look at their experiences and you may do the same. You may imitate your role models in your life, or you may say, gee, that doesn't work for them. It probably wouldn't work for me, and do the opposite or something in between. Peers are usually a huge influence on most people's understanding of sex and sexuality. The message, not just peers, but our whole culture gives, is that sex is really intercourse. And so that kind of limits the types of sex you might be likely to want to have or focus on or try. And that's a problem, particularly when you go through certain life experiences and sexual intercourse may not be an option for you. Partners, of course, can have a profound impact, positive or negative. Hopefully, if they're open and supportive, you'll be more comfortable dealing with sex and intimacy issues. The media is pretty distorted to me in the way it presents sex. It either sort of exploits it as a way to get attention, an easy way to get attention. And certainly the images portrayed don't show open communication about sex. You never see James Bond asking his partner, what do you like sexually? Everybody's just supposed to know. Men are supposed to know how to have sex with everybody they might encounter and want to. And in fact, of course, it's not true. And then the body types, most specifically in all types of media, are misleading in the sense of abnormally slim and youngish, and that's what's attractive. And if you're older, have a little more heft, you're suddenly not attractive, and poor body image. The college class I teach, the young women struggle with body image for years, and some develop eating disorders and so on. So it's a huge issue in our culture. School sex education is generally very limited. I've worked with dozens of school districts, and they spend just a few hours in 12 years of education on sex, and it's usually kind of don't have sex, and you'll get an STD or you'll get pregnant, and very limited amount of knowledge. So you end up with not real well educated people trying to through trial and error make their way through sex and relationships. And then last, depending on the religion, but sadly most are pretty backwards in my experience dealing with sex. They view it as primarily for procreation, which of course it isn't anymore. It's primarily for pleasure and bonding with other people. And if you have had the traditional sort of Christian, Judeo-Christian upbringing, you may feel so guilty about sex that you can't enjoy it. And I've had clients and students who cry after they have sex because they had such negative learning experiences around it. So the point is to take a minute and look at the types of experiences you've had, things that people told you or didn't tell you, and think for a minute, how did that set me up for a happy sex life or not so happy sex life? And you can take control of some of these and make changes through learning on your own, through talking to other people, and basically counseling as needed to expand your comfort zone and knowledge. So let's go on here. We're going to get more narrowed down to, I'm learning how to use my computer here. Here we go. Oops, not very well. Okay, there we go. So just focusing on older adult issues and both sex and intimacy. You've got the biological changes of menopause and andropause for men. Generally a decline in sex drive and sexual activity, but not completely, not the way the media portrays older adults as asexual, or it's funny if they're interested in sex. It's normal. And most people, even if they're not sexually active for a period, are still thinking about sex and have sexual feelings. Not everybody, but most. There's certainly changes in sexual functioning associated with menopause and andropause that we'll talk about more specifically, as well as cancer-related changes. People sometimes grow apart in long-term relationships, or they may grow closer together over time. And most relationships go through cycles of closeness and not so close, and hopefully back to closer times. We'll talk about that a little bit. Health problems, not just cancer, but any type, really can affect your interest in sex, your sexual functioning, and closeness with your partner, and so on. Losing a partner through divorce or death, of course, is very hard for people, understandably. So we'll talk a little more about that. Dating and relationships may start up again if you've lost a partner or have found somebody new. Even marriage in older adulthood is not uncommon. The interesting thing is I mentioned many women in their 60s report the best sex of their lives. And so it's not, even though you've got your body not supporting that necessarily with the menopause changes, you're more relaxed and you're not as worried about looking like a model or the false media images. And the same for men to some degree. But many people in their older, it's more relaxed and enjoyable and less concerned about judgment than when they were younger. There is the fact that there are fewer males available because men die younger. And so as you get older, you'll see supported living and senior centers with more women than men. And then last, this I mentioned before, the skin hunger, the desire for touch is really lifelong. And it's sad to me that for some people, sex is the only time they get loving touch, and if then even. And really, we can all do that with each other, hugging and hand holding and so on throughout our lives. So let me go on to the next one. We will get there on the cancer-related pieces. So menopause, you're probably very familiar with. You hear certainly more about it than andropause in general. Both of these are caused by declines in the key sex hormones, estrogen for women and testosterone for men. And also, as it says at the bottom, these effects can also be triggered with hormone deprivation therapies for certain types of breast cancer and other gynecological cancers, and prostate cancer, certainly for testosterone, reducing testosterone. So those can have profound effects on your sexual functioning and feelings much more quickly than the time it changes through menopause and andropause. The other big difference is for women, menopause is typically 5 to 7 year transition. For men, it's a much more gradual transition. You can see men's testosterone starts declining after 30, but about 1% a year. So when you're 60, you're down about 30% of your old rate, whatever that was. And obviously, as you get older, it slowly declines. So that's probably the biggest difference. But a lot of the symptoms or effects you can see are the same with, well, other than periods that men don't have, but hot flashes can happen for both men and women. Sleep problems. Women, again, tend to have vaginal dryness and atrophy because estrogen is what keeps your vagina lubricating and stronger and thicker walls and so on. But both can have osteoporosis. Women, again, seem to get it more dramatically generally, but men lose bone density over time as well. memory problems, aging, hormone neurotransmitter changes, and headaches can occur more often among women, but also among men at times. So it's interesting, we all focus on, well, men tend to have a more significant reduction in sex drive, even if it's slower over time, and genital response and erectile dysfunction, again, regardless of cancer or other health issues. So just to know that all of this is normal as you get older. When I'm in our group, prostate cancer support group, a lot of the men talk about these things, and I say, I'm experiencing that, and I haven't had prostate cancer. So just be aware that's the context that we're talking about, is normal aging related changes, and then adding the health and cancer factors on top of that. Let's see if we've got, oh, I keep turning the wrong way. Here we go. So what helps dealing with these is basic healthcare stuff, healthy diet, regular exercise. I'm going to go down the list and we'll come back and do this little breathing activity, because one of the keys to health and fitness is just regular breathing. But let's come back to that. Of course, not smoking, limiting or eliminating drug and alcohol use is healthier. Having other, like various types of social support in your life, friends, family, whoever you're close with. Staying sexually active certainly helps maintain your sexual functioning, but you can also regain it after a period of not being sexually active. Kegel exercises, we'll talk about. This is the pelvic floor strengthening for males and females. It helps with incontinence as well as sexual functioning. Let's see, using lubricant, of course, to compensate for loss of natural lubrication, although many women prefer lubricant when they are younger and haven't entered menopause, because you may not lubricate enough without it. And it's a great thing to make sex better. And then all the was it PDE5 inhibitors, Cialis, Viagra, and so on, is one attempt. Again, these are for men with just normal or common erection difficulties as they age. Penis pumps that suck blood into the penis to help with erection. Penis rings that trap the blood in the penis to help not lose an erection. Injections right into the penis that open up the blood vessels to facilitate an erection. Those are all things available and used by men, again, in typical health. And then last term, which probably doesn't apply for a lot of you because you might not want to replace hormones that you're naturally losing, particularly estrogen and testosterone. But for people who don't have counterindications, like certain types of cancer or treatments, they can help restore more typical functioning of a younger person. The problem is there's mixed research, but generally health risks associated with long-term hormone replacement therapy. So short-term, low dose can be helpful if there's no counterindications for helping. And again, that's something close, of course, to ask your doctor about. Let me go. I guess I have to comment. Of course, I'm older. I've experienced some of these effects, and the backdrop to this is accepting all of these aging changes as normal. And so I haven't pursued, and I know many people don't, the hormone replacement stuff because I'm concerned about the health effects, and I'm just leading a normal aging life. So we'll come back to that a little bit more. Now we're getting down to the cancer effects and treatment effects, both on sex, and then I talk about intimate relationships in more detail. So you got body changes going on. Of course, all of this depends on the type of treatment, the length of treatment, your reaction to the treatment, the type, and same with type of cancer and so on. But typically with treatments, whether it's radiation or chemotherapy, hormone treatments, you'll have more fatigue than you did prior. Some degree of pain associated with the treatment or certainly the cancer effects. Nausea, depending again on the treatment, classically with, well, radiation, but particularly chemotherapies. Scarring if you have surgery. incontinence, common with prostate cancer treatments and a few others. Hair loss may be an effect, weight gain. It's hard on your body to have to go through cancer and cancer treatment. So that's, again, the backdrop for talking more specifically about sexual and intimacy issues. Feelings, depression, anxiety, fear of death or loss of a partner. This can be self-esteem lowering because your body looks different. But I want to say hope, and I've been impressed by the guys in our that I've known, and I've known some friends with breast cancer, and this hopefulness, which comes and goes. I know people's feelings vary over time, understandably, but generally, with the increased quality of and availability of treatments for all types of cancer, but particularly breast cancer and prostate cancer being the more common. People are hopeful, and there are better treatments than ever, and there's many on the horizons that look even more promising. But you can imagine going through all the negative feelings that your focus on sex might be your top, not be your top priority at that time, going through these stressful diagnosis and treatment processes. And then in terms of intimacy, I think some people crave intimacy more. And feel that need. And some people distance themselves to sort of withdraw a little and focus internally, and that's understandable too. So we're going to definitely talk about this more. Let's see, your thoughts. I mentioned body image, how you see yourself, viewing yourself as asexual because you've had a double mastectomy perhaps, or you can't get an erection because of prostate treatment. You may be distracted with all that's going on with the treatments and so on, and just other priorities at that time. All of these are normal, and it's good to know these are normal so you don't think, what's wrong with me? If you're feeling all of this, then you're doing what you need to do. Behaviorally, you may be less active because of fatigue or other loss of abilities. And again, in terms of interaction with a partner, you may feel closer and want more interaction or pull back a little bit. And again, we're going to talk about these more. Sexual functioning, depending on the treatment, again, if you're taking hormone blockers or deprivation therapy, you're likely to have reduced libido. It's reducing your estrogen or testosterone, going to reduce your sex drive. That's normal. That's common to be expected. It doesn't mean it's forever. And then we talked about typical vaginal thinness and dryness. Also, an effect of estrogen blocking treatments and chemotherapy. They've found. Let's see. So that may result in coital or post intercourse pain or bleeding. Erectile dysfunction, of course, problems orgasming, and then but no ejaculation after prostatectomy, for sure. Prostate is what holds the fluids that are ejaculated, sperm, seminal vesicle fluids, all of these that combine in the prostate prior to ejaculation. Nothing's going to come out if you don't have prostate, but you can still have orgasms and pleasurable feelings. So if you have questions, okay, I see we have a question. Let me go look at that here. Talked about Viagra and Cialis and so on. Are there similar treatments for women with regard to libido and vaginal pain? Great question. There's something marketed as a sex drive increase drug for women. They call it the pink Viagra. The truth is it doesn't work the same, and it has a lot of negative side effects. And in the studies on it, it's increased the frequency of sex that women who take it have by one more time a month over women who don't take the drug. So I don't advocate use of it. You can ask your doctor. It's a psychotropic drug. It's not the drugs that help men increase blood flow to the penis. And that's not how this drug for women works. And so I don't recommend it. But again, if you're concerned, there are other things I think you can do health and interaction wise that can help build libido more effectively. And again, men are lucky that it's really erections, at least, are a blood flow issue. Sex drive for men, also hard to build. You can take estrogen for women and you can take testosterone for men, and they may boost your sex drive, but you just have to make sure there aren't biological reasons not to take those, that they can contribute to your cancer. But definitely on feeling pleasurable, again, I'm talking about now the lubricants and things that women can use to make sex more comfortable. It won't affect, well, it might affect your sex drive if it doesn't hurt, if it's more pleasurable. So in that sense, it could. But generally not as much available for women in terms of arousal and so on. One thing I do want to, I realized I skipped the breathing activity. So this is a perfect way to begin your own therapy processes for anything dealing with pain, stressful situations, maximizing your vigor for sex. And it's breathing is the basis of yoga, high performance sports, high energy sports performance, really everything. And our culture is so busy. Usually we literally forget to breathe sometimes. And so I wanted to lead you through this little activity. So if you're game, where you can play along, it's I just want you inhale through your nose for 4 counts like this. Hold it for 7 counts. And then blow out through your mouth for 8. And you do this 4 times. And there's been research on this. And if you do this a couple times a day, 4 times each, over a course of a couple of months, blood pressure goes down, anxiety goes down, and depression can improve. And there are other benefits too. But let's just do a couple. We don't have to do 4 because I don't want to run out of time. But here we go. I'm going to model it and do the little countdown here. So in through your nose, hold it, out through your mouth. So here we go on the intake. By blowing out, you get all that carbon dioxide out, and they make room for more oxygen. So let's do one more. In through the nose. Now, breathing is amazing. It's the simplest but most powerful thing we have available. So I encourage you to do it. It helps you fall asleep. If I wake up in the middle of the night, can't fall asleep, I do 4 of these, fall asleep usually within about 15 or 20 minutes. Okay, let's go on back to some more specifics about this is from, I taught this class about 1.5 years ago in a live setting, and these are actually quotes, comments from the participants then. I thought I'd share them with you because we can't do quite as much interaction this way. But some of the sex and intimacy concerns expressed by the people in that meeting included fear of losing the ability to perform sexually, fear of rejection by a partner for various reasons, fatigue and hormone deprivation therapy reducing their sex drive, and concern about their body shape and image. And all of those are normal, understandable, reasonable concerns. I think, that, again, there are both some physical things and some psychological things you can do to address them, and social things with partners. But look at these quotes. These are from mostly breast cancer, but some other types as well of female survivors. This is a common theme. My doctor never brought the subject of sex up. I had to bring it up and ask him questions. But talking to other women who've been through it were among the most helpful things. And I encourage you again to even if it's just short term, get involved with a support group. In our group, when newly diagnosed men come to the group and hear the stories of the survivors, the long-term survivors in the group, it's generally very both educational and supporting. So I encourage anybody with cancer to talk to other people who've been through the type that you're dealing with, and to ask your doctor about it, because they're not sexologists. They haven't been specifically trained in talking about sex, and they may feel they'll make you uncomfortable if they bring it up. If you bring it up, hopefully they'll answer your questions. We were both in denial. This is a friend of mine who had a double mastectomy, both in denial during my breast cancer experience, him ignoring my illness and me ignoring the need of support from him. And this is common. The couple was having trouble prior to this a little bit, not extreme. The man's mother had died of breast cancer, so he couldn't take talking about it with his partner, his female partner. And she sensed his discomfort and so wouldn't bring it up. So they really had this lack of communication and actually ended up ending the relationship. Since then, I think she's found ways to bring it up herself with new partners and get the kind of support she needs. Here's another one. We were both in denial. Oh, I'm sorry, that's it. I considered getting implants after my surgery, but thought the thought of having a foreign object in my body that has to be replaced every 10 years, which is typical with breast implants, was not appealing. So I managed the unevenness in her clothing and breasts with prosthetic inserts in her bras, and she was happy with that. And I love, this is from the same person. My self-image after the surgery was not great. I always felt the need to explain what happened before a sexual relationship was about to begin. To my surprise, the results have never been negative, meaning partners haven't cared about her scars, different looking chest. And that's great. And I would argue other people have had similar experiences. I've had students who had the same kind of thing. And then last, that nobody told me chemo, not hormone treatment, could cause a sudden loss of estrogen and lead to menopause symptoms and pain and bleeding during intercourse. So doesn't have to be estrogen related directly with chemo. So these are some common concerns, and we'll talk about ways to address them. For males, these are some of the quotes from guys in the groups, other men I've talked to about prostate and other cancers. First off, cancer is a scary term for anybody. To think there's something growing out of your control in your body is scary. So that's a common theme. This man was in our support group and shared this story and wanted us to share it with others. After I was diagnosed with prostate cancer, my wife and I went on a cruise. One night I considered jumping off the ship. Thinking about our support group helped me stop. And this man was amazing. He went on to counsel other peers in the group, helping them get through the depression that he experienced. In fact, I learned later his father had died from prostate cancer. So you can't imagine something much more scary than having that experience after losing a relative, close relative to that. Another man shared, first I was sad, this was taking Lupron, one of the common testosterone inhibitors for men with prostate cancer. First I was sad because I lost my sex drive, then I was sad because I didn't care. And knowing the feeling that men typically have, sexual desire, to lose that is hard. And doesn't mean though you can't have sexual activity and intimate involvement with a partner, and we're going to get there. You don't think you'll be able to get an erection again. You don't think you'll be a man again. And isn't it sad that we equate being a man with having an erection? I understand it, but there's so much more to being a man than that. Kindness and sensitivity and caring and so many aspects of life that are in some ways more important. I tried penis pumps and Viagra, but the penile injection worked best for this person. I have heard that from a few other men. One of the themes here is don't give up. Don't don't try one treatment and say, well, that didn't work, so I'm done. There are multiple approaches to most conditions. And I would talk to different doctors, talk to other health providers, talk to peers who've been through it, and you'll learn, and we'll talk about some of the other approaches you can take. I mainly have intercourse for my wife. This was a man who didn't have much sex drive at all, but enjoyed giving her the pleasure, so he would inject himself so he could get an erection, have sex with his wife, and please her in that way. Incontinence, huge problem for men with prostate cancer and some other types of cancer. Dealing with incontinence is a journey. You worry that you might pee during sex. So we just laughed about it, and that helped. And if you're interested, some of this quote I actually pulled from a YouTube video. Look up sex for cancer survivors on YouTube. And there are a lot of both therapists talking and people who've experienced it talking. And there's some neat, very candid and meaningful testimonials, interviews there. Now we have as good a sex life as ever. That's the other thing, is it may take time, but generally with prostate surgery or radiation or breast cancer and other gynecological cancers, you can recover a lot of your prior functioning with the right steps. And I love the theme, there's light at the end of the tunnel. It doesn't seem like it when you're newly diagnosed and going through painful treatment or difficult treatment, but it does get better. Every man and woman that I've talked to felt that way. It's just hard at the beginning and the middle sometimes. So let me go on here. Let's see, is there another, I think I've got another question. Are there any sex therapists in Santa Barbara? That's a great question. Yes, there are. Don't assume every therapist is a sex expert. Some are, but ask them if they. I used to train sex therapists, and they to become a licensed counselor in California, you only need 10 hours of sex education. I give more than that to my students at the colleges. So, but yes, there are. And if you, I'm trying to think, you can contact me. I have my email at the end here, and I can refer you to some people. There are some great therapists here. And will the slide deck be available? Yes, the whole presentation is going to be available on video, and I think we'll talk about that at the end. But great questions. Thanks for asking. Here we go. This is more input. What are the goals from my prior class? Goals for intimacy: feel closeness and connectedness, connection, understanding your partner's needs, always a challenge and important, sharing our feelings, increasing non-sexual touch. I'm going to talk about more. Goals for sex: maintain sexual activity with or without intercourse. We'll talk about non-intercourse sex. Improve your body image post-mastectomy. Being less shy. That's back to the sexual learning theory, where people learn to be ashamed of their bodies, particularly women. How to pleasure a partner. How to get more lubrication, and just being more joyful and open in your sex life. And if you have other goals for either sex or intimacy, go ahead and type them in, and I'll try to address those. But I am going to go on. So defining intimacy, again, I mentioned closeness, connectedness, but it doesn't have to be a romantic partner. Some of you may not have a partner, and that's okay. A lot of these ideas apply with friends, family members, anybody you feel close to and trust. You do have to be willing to be vulnerable if you're going to share personal feelings, and to trust that the other person's going to be supportive. And part of that, of course, is based on your history with them, but also with other people. If you were, cheated on or misled or poorly treated before, it's harder to trust people in the future, and that makes sense. But you can slowly rebuild trust in little steps. There's different types of intimacy. Mostly we're talking about emotional intimacy, feeling comfortable with closeness and sharing and being supportive. But there's physical intimacy through touch, sexual intimacy, people are more familiar with, intellectual, being able to discuss things openly, and then spiritual intimacy, feeling really connected in a deep way with other people. The barriers to intimacy, the shock and stress of diagnosis I mentioned, it may not be the time for you to connect when you first find out. You may want to withdraw a little bit and think about it and process it, and that's okay. That's common. And then, but at some point you may need closer support, and that's also common. Some people fear about losing a partner, especially late in cancer, and may even start to distance themselves to protect themselves from the tremendous loss that they may feel later when they lose someone. That's normal, but it can also be discussed and addressed, and say, I need you now while I'm still here. Increased vulnerability, totally understandable. You're sick and dealing with treatment and cancer effects, and are more vulnerable, and so it makes sense you'd feel that way. Again, talking to people, a friend, a partner, close person, can help get that out and say, okay, it's okay to be vulnerable now. That's normal and what you would expect. I mentioned old wounds. If your trust has been violated before, if you haven't grown up in a family or around people who communicate about feelings, it's hard to start doing it all of a sudden. So, we'll talk a little more about that. And then if you're unsure about your partner's needs or feelings, of course, ask them, and just listen, and don't try to solve their problem. Just listen is really a key. So how do we maintain and build intimacy? That we're getting to the real meat of it now. I think give yourself and your partner time to adjust to the immediate effects of being diagnosed and early treatment. Increasing self-awareness. How am I feeling? What am I thinking? How am I behaving with others and with myself? I know some of the men in the group shared that they started drinking a lot when they were first diagnosed, and then they found out alcohol is not really good for any type of cancer. It may help you feel better, but a lot of them channeled it into, I see two directions: physical activity, staying physically active, even just walking, bike riding, but also things like meditation, yoga, and of course, talking to others can help with self-awareness. Accepting yourself, that I can't say that enough times. Your body's going to change, and accepting that and saying, this is me, take it or leave it. And as we heard from the one quote, most people will take it if they're supportive and caring. But looking at your own, saying it's okay to feel this way, it's okay to think this, because that's where I'm at right now. It doesn't mean it's long term, and that's an important point. Take time for yourself. Staying active, relaxing, exercise, focusing on your partner as well. And I'm talking to a few partners, mostly people with cancer themselves, but both needs. Your partner may be suffering emotionally because they're scared to death about you. And in both directions, the supportive people, the partners and the individual, can initiate conversations and focus on each other. Share your thoughts and feelings and needs. You don't have to do it all in one talk. Start the initial conversations with things like, I've been thinking about this, whatever it is: sex, love, loss, anything you want that's actually going on for you. And then I'd like to talk about it. And then you've opened the door. And if they seem reluctant, you may need to give them some time. It may be too hard or scary for them at that moment. But with time and sort of these gentle approaches, some people even write it down, write notes to each other. I have a friend whose partner is so reactive, he writes her notes and gives her time to think before she responds. And that works for them. However you prefer to communicate. Do things together, of course, to maintain that closeness and just time together. Walking, making meals, taking a class together, whatever it is. Spending some quality time together to maintain that bond. Research has shown real clearly that you need 5 positive interactions with a partner to every 1 negative one. A lot of people think, well, 1-to-1's okay, or twice as many positive as negative. But the research on divorce and relationships ending is real clear that you need the 5-to-1 or better, 7, 8, 9, 10-to-1. Positive to negative interactions for it to have a good chance of maintaining or succeeding. So just so you know, these are like whole classes in themselves. I'm kind of rushing through, but I want to get the ideas out so that you can look for these things in your own life with your partner and with a therapist if you end up with one. Um, Using other support systems, you can't put it all on one person, whoever it is, your partner, your friend. You need to talk to multiple folks. And again, I think other family, other friends, peers in these peer support groups, counselor can all be supportive. Some people, clergy, might be helpful in processing what you're going through. Um, Attending medical appointments together, if you have a partner or a friend, it can help you. You're so, you can't take everything in a kind of crisis medical interaction. And so to have somebody else there who can ask questions you may not think of or just be there to support you and listen is tremendously valuable for most people. And then literally scheduling times to talk, to listen, to cuddle. Again, research at least once a day on the cuddling. It releases oxytocin, other positive hormones, neurotransmitters that make you feel better and help you sleep and all kinds of benefits. So just doing that hug at bedtime or at the end of the day or evening is so valuable. You've probably heard about love languages. People show love in different ways. Here's some of the different ways through just touch. We talked about hugging and hand holding, anticipating your needs. Oh, let me get that for you. Can I help you do that? Or I'll make dinner or whatever it is. Helping in any number of ways. Sexually, people may show love through sexual interaction. Giving gifts. Mostly paying attention and listening goes a long way to say, I care about what you're saying and I want to hear it. And I may not be able to give you an answer, but I'm here to listen and support. Praising and complimenting, especially with long-term couples, you can get into, just a pattern of, each other so well, you don't talk, you don't compliment, what they're like, you're not surprised, but do the compliment, say, oh, I really appreciate how you this, or I really like this about you. Let's do a quick activity here. Think for a minute, what's something you like about your partner? And if you're with them now, tell them when we're done, and you don't have to have a partner. What's something you like about yourself? We need to do affirmations too. Oh, I think I'm good in this way, or I like this about me. We're going to hurry because I'm getting low on time. Expressing appreciation, thankfulness goes a long way. One of the ways people maintain happiness is doing things for others and being thankful for what they have and recognizing what they have. Flirting around and being playful doesn't have to lead to sex, but just playing. Enjoying things together, sharing feelings I've talked about. Learn your partner's love language. If you don't know what makes them feel good, ask them and look at how they respond when you do different things. And once a day, do it for them and or yourself, again, in terms of personal affirmation. Okay, sex, we're going to redefine. It's not just penis and vagina intercourse. Many other behaviors may not be called sexual, but they can be sensual for sure and pleasurable. We talked about flirting, slowly building interest and arousal. As my wife and I have gotten older, we sort of tease around leading up to sex, maybe in a day or so, to build the arousal and excitement. Just little things, touching. I have some underwear I wave around. Whatever works for you, but this playful approach really goes a long way, kind of reduces the fear of rejection, I think. Holding hands, hugging, kissing, we've talked about. Non-genital touch, massage, just rubbing somebody's arm. It doesn't have to be a formal massage. Sensate focus is a sex therapy technique, not exclusively by any means used with people with cancer or other serious health problems, but just for couples who go right to the genitals or breasts and think that's it. And you've got the whole rest of your body. They say skin is your most erotic organ. And it's much bigger than genitals and has so many nerve endings, and particularly face, ears, neck, hands, and feet. Um, take a minute and just do this. Put your hands together, and for yourself, feel, is it warm? Is it cold? Is it rough? Does it feel nice? You want to get real crazy, do this business. Just, feels good. My hands are colder than my face. Do it with a loved one. Cradle their face and just look at them and think about how much you care about them and tell them. Um, Certainly masturbation or self-pleasuring is to me, a form of sex or a way to appreciate yourself or a partner, using your hands or sex toys, vibrators, dildos, clamps, whatever works for you, little feathers, blindfolding, or it heightens your other sentences when you're not focusing on what you're seeing. So that can be a helpful sexual technique. But multiple ways to pleasure another person. Oh, I didn't mention, I worked with some men who had spinal cord injuries, had no feeling from their chest down, and they found head and neck stimulation, just touching. They said they could have orgasms, or what they considered orgasms, just by having their ears and neck and face rubbed, and that there was a buildup of tension and a release like traditional orgasm. You can have orgasms. Men who've had prostatectomies certainly without ejaculation, but even without an erection. So we put so much stock in erection and typical arousal. There's so many other ways to enjoy your body or another person's body. Focused on the pleasure, not having orgasm as the goal, the big goal. If you want to, there are things you can do to facilitate it. Vibrators for women, and lubricant if you're doing penetrative things. But really, these clitoral vibrators can be tremendously effective. Using it with a partner. I worked with a woman who's never masturbated until her husband was dying. And he would hold her while she masturbated. And he actually taught her it's okay to masturbate. It's a good way to enjoy sex. And he would just hold her because he couldn't do much more at that point. And she kept it up after he passed, and it was meaningful to her in a lot of ways. There's certainly role-playing, costumes, fetishes, BDSM, bondage, and kink activities, sadomasochism, spanking, and those kind of things that can be fun. It's not as weird as people think. I've talked to BDSM practitioners, had them speak in my classes, and it's a whole other level of trust and communication that many people never achieve, really. And then, of course, just basic communication about what you like and what you don't like. You are more than one part of your body. You're more than your breasts. You're more than your penis. It's so important to recognize that. Sexual enhancements, I mentioned some of these. Planning your sexual encounters so you're kind of in the mood and not stressed about other things. For women who have had breast surgeries, breast reconstruction is a possibility, prosthetics, sexy clothes, bras that are complementary with the prosthetics, particularly Kegel and pelvic floor exercise. There's a place in Santa Barbara, a doctor, it's called the Pelvic Floor Institute. She works with women who've recently delivered babies, anything that stresses your pelvis and your genital area. And for men, for dealing with incontinence, and women dealing with incontinence. Incredibly valuable stuff. It's not just one muscle, it's a whole bunch of muscles. You have to learn to control them by tensing up your pelvic floor, but in specific ways. So I really encourage you to pursue that for erection problems, incontinence, orgasm problems. It can really be helpful. New sexual activities you haven't tried and new positions. Lubricant Replens seems to be the most commonly recommended for women dealing with vaginal dryness. There are vaginal creams that have estrogen. Check with your doctor. They're not systemic. They don't generally circulate throughout your body the way orally ingested or injection estrogen does. But check with your doctor if you want to try vaginal estrogen cream. It can help with sexual functioning. And then there may be a little bit of libido impact there too. But vibrators, dilators, if your vagina is clenched shut for any reason, you can buy, I think literally through Amazon, little dilators that progressively get bigger to gently put in your vagina with a lot of lubricant to slowly make it more comfortable being penetrated. If you haven't had penetrative sex in a long time, it's probably a good idea to do it gradually like this. I've mentioned these other things for men. There are penile implants for men who want to go that route. But as the bottom picture shows, you can have a strap-on dildo and have typical penetrative sex if you want to go that route without sort of forcing your penis to have an erection, particularly if it doesn't feel good for you. This is another route to go. Other equipment toys, I mentioned cushions to get different angles, BDSM gear if you're into that or want to learn about that. Communication throughout sexual encounters before and after. New times and places. Outdoors might be a nice place to, even if, again, kissing, hugging, it just being the fresh air, being in a new setting can be motivating. Sex talk, reading erotica, viewing porn together can be helpful. Sharing fantasies with your partner, playing them out to the degree you feel comfortable. And then tantric sex, if you're not familiar, there are some great videos on the internet. It's really about connecting in a very deep way. It sort of integrates yoga with sex, and it's synchronized breathing together, hands on hearts, eye contact, slowing down the whole sex process. Very effective, again, regardless of cancer, other things, but especially helpful if you have a health problem going on. I'm sorry, these are so quick because we're out of time, but having patience with yourself. These are things people classes talked about. Learning to relax, to communicate, educating yourself, being responsive to your partner's priorities, planning time. I talked about some of these things. A bra that, if you have a single mastectomy, you might want to keep the other side, the scar side covered, and just make your other breast. You can get a breastfeeding bra, cut a bra to open. I've looked and haven't found any that open independently, but one woman said that's what she was pursuing. Change of medication if that's having effects you don't want and your doctor's supportive in terms of the health effects. And then what has helped, people had said, holding hands, touching, hugging, partner support, trust and communication, flirting, not being pressured by your partner to do things you're not ready to do, spending other non-sexual time together, and of course, if you want to pursue it. I just want to leave with this quote, a man who was in the prostate support group. As I've gone through this whole process during the last 2 years, I've had many discussions with my wife about the issue of sex and intimacy between us and what it will mean going forward. With gentle care and loving heart, my dear wife has been patient and loving and caring. We both understand as we grow older that the most important thing in life is our relationship that we choose with each other when we married. For that, I can only be most grateful. So the potential for support, again, not just from partners, but from friends, others who, if you're willing to share with and be vulnerable with, can be incredibly supportive of you. So let me just see, I think, so your homework, yes, you do have homework, is to think about, of all the things we've talked about, or when you review this, if you do again in the future, what's one thing you'd like to try or say or do for yourself, an affirmation or something you want to do with yourself or with a partner, and try it out and see how it goes. You really have nothing to lose and a lot to gain, I think. And if you want, and if therapists can be really helpful. And again, I'm available. My email address through Ridley-Tree is there. Please do contact me. If I can't answer questions or give brief sort of advice, then I can hook you up with one of the therapists in town. I know a few of them pretty well. So if we got any last minute questions, now's the time. Let me see if anybody's added any here. Oh, we did have one question submitted in advance. Thanks for the reminder. And it was about sex drive and for men and erection functionality. And so, yes, if you take androgen blockers, Lupron is the most common one for prostate cancer, it will deplete your testosterone. It will reduce your sex drive significantly. But it doesn't mean you can have sex. We heard some examples. The PD5 injection, medications, penis rings, and so on may help, even though but you won't necessarily be as driven to have sex as you were before. There is intermittent therapy. Ask your doctor. Some men stop the Lupron for a while. It usually takes a while for your testosterone to come back, but it can. Typically, and then they asked about surgery and nerve damage. Yes, if you have a complete prostatectomy, to be cautious, doctors typically take the nerves around the prostate, which can reduce arousal. Typically, it comes back within about a year, by about a year. Normal sexual functioning and drive may take longer after you quit the androgen blocker therapies. Again, I'm covering all this stuff very briefly, but any other questions? Now's the time. I probably need to get out of here, but I appreciate you listening and joining us and your questions that you've submitted. And I'm happy to talk to you further via email here, and we can even set up some phone calls if you'd like. So I think that's about it. I'm going to hand it back. Oh, we've got one more slide where I want to thank Young Mi again and Chris for helping set this up.